Thanks, Kate, and thanks everyone for joining us again this Friday. I will give a update on where we're at with the numbers, the epidemiology, and talk about where we may be headed, and then welcome some discussion with you. Overall, the forecast is mostly sunny with a chance of rain. We've had 83,806 cases reported in King County residents since the outbreak began, with over 5,100 hospitalizations and 1,435 deaths. Our case rates have leveled off a bit above where we were when the third wave took off last fall. We're seeing about 130 to 140 cases reported a day over the past several weeks. Hospitalizations have fallen to levels comparable to those before the recent spike, with one King County resident hospitalized every 5 hours, or approximately 5 hospitalizations per day, which is also comparable to what we saw in late September before the third wave. And it's gratifying to report that deaths have also been declining, but one King County resident is dying of COVID-19 every 8 hours, or 3 deaths per day, and this remains above the level we saw in the summer and the fall. It's also good to note that we've gone from dozens of outbreaks and hundreds of cases reported from long-term care facilities each week to single digits in recent weeks. So summarizing our recent trends, our cases are decreasing after the third wave, but we've leveled off, and rates of transmission remain substantial. This means there are thousands of people with infectious COVID-19 in King County each day. So continued caution is advised, particularly with increasing numbers of more infectious variant strains, which I'll say more about in a bit. You may have seen several media reports recently discussing the fact that Seattle and King County have fared relatively well so far in the pandemic compared to other areas of the US. And while this is undeniable and a reflection of the good collective work and the endurance of our community, it's also important to recognize that within our county and even within the city of Seattle, some of us have done better than others. For example, Seattle and King County have among the lowest incidence and death rates in the country compared to other large metro regions. Yet these overall numbers mask disturbing differences in the impact of COVID-19 from neighborhood to neighborhood within the county and even within the city. Throughout the pandemic, cases, hospitalizations, and deaths have been several-fold higher in neighborhoods in Auburn, Kent, Federal Way, and Burien, Renton, Tukwila, and SeaTac compared to other neighborhoods in Seattle, Shoreline, the East Side, and Eastern King County. Within Seattle, we can see similar disparities between neighborhoods in Central and North Seattle compared to those in Mount Baker, Rainier Valley, West Seattle, Delridge, and the Highline neighborhoods. Even now, as our countywide numbers are falling, cases and hospitalizations remain 2 to 3 times higher or more in these communities. And these trends are reflected in higher rates of COVID-19 cases, hospitalizations, and deaths among those who are Black, Indigenous, and people of color. One of the ways we're trying to address this is through focusing on equity and vaccine access, and I'll speak more about that. Now, you likely heard the news from the governor yesterday that every county in Washington state, as of March 22nd, will move forward to phase 3. And it's great to see increasing optimism about the recent COVID-19 trends. And I think we all share the governor's enthusiasm for a return towards normalcy as soon as possible. At the same time, it's important to keep in mind that as we move forward towards normalcy, there is still significant uncertainty about how the pandemic will play out over the next few months. And we can't let our enthusiasm blind us to the need to remain cautious in how we go about our lives and our business. Now, there are a few things that are happening at the same time in the context of our falling case counts that together will determine how we do over the next few months. These include the increasing variants of concern, the pace of our vaccine rollout, and our behaviors. First, the variants. As you've heard, the P1 variant strain first identified in travelers from Brazil, has been detected in a COVID-19 test from King County. At this time, all three of the main variants of concern in the US have been detected locally. The most prevalent, the B.1.1.7 variant, as well as the B.1.3.5.1 variant, spread significantly better than previous strains, and it's possible that B.1.1.7 may cause a more severe illness. But it's important to note that current vaccines offer a high-level protection against this variant. Preliminary information on vaccine effectiveness against the other strains suggests protection may be reduced to some degree, but more information is needed. The B.1.1.7 and other variants are a wild card that can hurt us if we're not careful or if we're unlucky. But it's a major advantage that our current vaccines protect against the most common B.1.1.7 and likely provide significant protection against the others. The bottom line is that although overall transmission is decreasing, the viruses that are out there are more likely to be the more contagious B.1.1.7 variant, and that means we all need to be careful. Although it looks like we have an advantage at the moment, if we want to keep it, we need to work for it and to continue to respect this virus. Another key factor that will increase how we fare in the coming, another key factor that will influence how we fare in the coming weeks is vaccination. I have a milestone to report to you today. There are now more King County residents protected against COVID-19 through vaccination than have been infected in total since the outbreak began. Approximately 440,000 King County residents have received at least one dose of vaccine, compared with 290,000 King County residents who have been infected over the course of the pandemic. Of these, 250,000 King County residents are fully vaccinated, and another 190,000 have received their first dose. And most of the vaccinated people are those at highest risk for hospitalization and death. So what this means is that fewer hospitalizations and deaths would be expected from a surge due to the current strains. Now let me speak a little about our vaccine program. The governor also announced that we're moving to the next phase of vaccine eligibility on March 17th. And there has been some remarkable progress across the county in reaching currently eligible populations with vaccine. But we anticipate that in King County, as vaccine eligibility expands, the gap between supply and demand will increase. There will be hundreds of thousands of new King County residents becoming eligible before corresponding increases in vaccine become available. So it may take several weeks before those who are newly eligible for vaccine are able to access it. But when that supply of doses does increase, and we know it will, we have the capacity to distribute vaccines on a much larger scale. For example, our current rate of vaccination is about 100,000 doses per week, and that's risen gradually with increasing vaccine supply coming into the county. We do have the capacity, however, in place to administer at least 300,000 doses per week, 3 times what we're currently administering, as soon as vaccine supply is available. And that supply and those doses will be distributed through our healthcare providers, our community health clinics, pharmacies, our high volume sites, special events, clinics, and mobile vaccination teams throughout the county. So here's where we are today. Almost 1 in 4 King County residents has received a dose of vaccine. As of March 11th, 76% of those who have been eligible for vaccine received the first dose, and almost 250,000 residents have received both doses. The proportion of older adults getting vaccinated continues to increase. 77% of residents 75 and older have received at least 1 dose. That's up from 44% in mid-February. And 70% of residents 65 to 74 have received at least 1 dose. That's up from 40% in mid-February. So we are continuing to focus on vaccine equity to ensure access for people at highest risk and communities that have been most impacted by COVID-19, and continuing our work with BIPOC communities to eliminate disparities in vaccine coverage. Our data show that for those 65 and older, 71% of whites have received a single dose of vaccine compared to 60% of Hispanic and Latinx community members and 54% of Black and African Americans in that same age range. So we're starting to close the gaps, but we must continue to work if we're going to further close them and achieve true equity in the immunization coverage. So here are a few things that are happening this week to help us achieve this equity and coverage. We know that child care workers are more likely to be people of color and experience barriers to vaccine access. And we are carrying out targeted outreach to the child care sector to facilitate access to reserved appointments at our Redmond and Renton partnership sites. And we're conducting with partners numerous faith-based organizations and community-based vaccination clinics today and this weekend serving the BIPOC community. And we very much value our partnerships with these community organizations that are trusted and work to provide vaccine to our communities at highest risk and who are experiencing disparities in COVID-19 rates, and others that have barriers to access for vaccine for a number of reasons. Before I conclude, I want to mention that our region is in desperate need of blood donors right now. BloodWorks Northwest has informed us of this, and as a public service, I want to let you all know that local blood supplies are at very low levels. There is no wait to donate blood after receiving a COVID-19 vaccine, so that should not be a barrier. And I want to encourage everyone who's able to donate to make an appointment. That's something you can do by calling 800-398-7888 or contacting bloodworksnw.org, and we'll paste this information into the chat. So in closing, there are many ways in which we're moving in the right direction, and I thank everyone who's continuing to endure this marathon and helping our community reach the finish line. But we should have no illusions about the fact that COVID-19 can still deliver a knockout punch if we lose our focus and turn away. As we open up and have more in contact with one another, there will be more opportunities for COVID-19 to spread. So if we do more, let's be sure to be smart about it. And finally, I was saddened to learn that Norton Juster, the author of The Phantom Tollbooth, died this week. The Phantom Tollbooth is one of my very favorite books. I've read it many times. And there's a character in the book called the Weatherman, who I think has good advice for us today. Expect everything, I always say, and the unexpected never happens. And with that, I look forward to our discussion time.
Thank you. All right, for media, if you have a question, please use the raise your hand function in Zoom. And when we call on you, please state your name and your outlet. First up is Nick Popham. Nick, go ahead.
Thanks so much. Hey there, Dr. Duchin. Nick Popham with Como TV. Was wondering, with regards to vaccinations, how do you fight against vaccine hesitancy this far into the ballgame? Is this still something serious that you think is an issue, or do you think we're having a good job in fighting against vaccine hesitancy right now?
Yeah, thanks, Nick. We know that people have concerns about vaccination in general, and we know that people have concerns about COVID-19 vaccination in particular. And there are a wide range of types of concerns and different, it's hard to generalize across the whole population about why people may or may not be coming forward for vaccination at this time. But what I can tell you is that our demand is very high. I don't believe to a great degree, people the vaccine hesitancy is impacting our numbers at this point. However, we are doing a lot to push information out about these vaccines, about how they were manufactured, about their safety and effectiveness. about how that was established and reviewed in a public forum, and to answer questions from community in a variety of different forums. We have resources that are available in numerous languages. We have videos that we're posting, and we're trying to engage community to understand when people have concerns, what they are, and to give them information that they can use to make the best decision for their own health about COVID-19 vaccination. Clearly, the more people that are vaccinated, the more who will be protected, and the more our community as a whole will be protected. But we understand that people have concerns, and I think it's good for people to think about their health care and what medications and vaccinations they receive critically. And we're working very hard to answer questions and provide information that will help people make the right decisions. At this point, though, get back to your bottom line question, I don't have evidence that vaccine hesitancy is a major problem for us. I think as we go forward in the program, those who are enthusiastic to be vaccinated will have been vaccinated, and there will remain people who are still not sure. And it will be, increasingly important to reach out to those people and try and answer any questions they may have, so that they can, take the right steps to protect themselves, their families, their communities.
Next question is from Carolyn Bick.
Hi there. Yeah, Carolyn Bick here from the South Seattle Emerald. Thank you so much for taking my question. I actually have a couple. One I think is less long than the other, so I'll ask the longer one first. Is public health planning to create mobile vaccination teams that are specifically meant to visit homebound elders directly in their homes, if those folks have no other feasible ways to get to the vaccination site or get a vaccination at a community center or familiar place?
Yeah, thanks, Carolyn. We are hoping to do that. Those plans are actually in progress now. We are, as you know, we've had a lot of mobile vaccination teams reaching adult family homes in partnership with EMS and fire agencies throughout the county. And we are working with agencies that care for and support homebound elders, and with our community vaccination partners to be able to provide that service as well for that group.
Thank you. And then secondly, going off of what Governor Inslee announced yesterday, do you have any specific concerns about allowing large-scale spectator events, given that it might be a little bit difficult to ensure that everyone is masked and distanced at said events?
Yes, I have concerns. I think we all should, and I think those concerns should lead us to take precautions. Clearly, outdoor transmission is less likely, much less likely than indoors. The greatest risk is indoors, air spaces where people come together, particularly if they're not wearing masks, spend longer time, and where ventilation may not be very good. But outdoors, there's lots of natural airflow, ventilation, and the risk for transmission is much less, but it's not zero. So even outdoors, close face-to-face contact, particularly without masks, can present a risk. And other areas that are protected from airflow and ventilation where people might congregate can present a risk. So I do have concerns. I understand why, we're opening as a state, and why people feel like this is an important thing to do. And I think that only time will tell, where the course of our outbreak is headed based on these increasing levels of activity. I think I acknowledged in my comments that there's a lot of uncertainty about where we're headed, but there are multiple factors that will come into play. One of which is how much activity we partake in, whether that's indoors or outdoors, and the precautions that we take. And then the big unknown is the role of the variants, whether they will significantly accelerate transmission in our community, or whether we'll be able to vaccinate enough people and take the precautions that we need to take to continue to limit transmission. But it's hard to predict. So that's why I'm encouraging everybody, particularly now that we will be allowing and engaging in more activities where COVID transmission is potentially possible, to do everything you can to make that not happen, to limit the opportunities for transmission, to continue to distance from others, to wear good quality, well-fitting, snugly fitting face masks, and to pay special attention to indoor ventilation, not to gather indoors for prolonged periods, particularly without masks, and in spaces where the indoor ventilation is not adequate. I think if we're really careful and we do things right, we will be able to be successful in moving forward on a decreasing trajectory. And as increasing numbers of people become vaccinated, we may be able to come into an equilibrium with the virus that we can live with. But it will take some effort, and I think everyone should be concerned, and everyone should use that concern to drive good COVID-19 prevention behaviors in their personal lives and in their work lives.
Thank you. Next question is from Jessamine McIntyre.
Hi, Dr. Duchin, Jessamine McIntyre, Q13. It's good to see you. Thank you again for your time. Governor Inslee also today, he's been busy this week. He just announced that he will sign an emergency proclamation requiring schools to offer some in-person learning. Do you have any concerns about schools returning?
Well, Jessamine, thank you for your question. I think we all should have concerns about COVID-19, but I don't think those concerns necessarily should prevent us from doing things that are important and that we can do safely if we take the right steps and the right precautions. So, we have for months now acknowledged that given appropriate precautions, in-person learning can be carried out with relatively low risk. And there's no such thing as no risk right now with COVID-19, and this virus is going to be with us for the foreseeable future. So, as I said, we're going to have to live in balance and equilibrium with this virus. It will cause infections, and our goal is to, through vaccination and through prevention measures, to minimize the number of infections it causes in every context of our lives, and including schools. Schooling and person learning is incredibly important. We've acknowledged that. I think everyone agrees with that. And we support schools in trying to get back to in-person learning. And I believe that there are very good guidelines out now that will allow schools to do that with minimal risk. Particularly, I would like to point people to the new guidance from the Centers for Disease Control and Prevention on ventilation and air handling in schools that further will reduce risk from what had been previously recommended. So again, yes, I have concerns. I think we all should have concerns, and we should use those concerns to drive our behavior in a way that will minimize the risk to everyone.
Thank you. Next question is from Kayla Lafferty.
Hi, thanks so much for taking my question. So can you give us a rundown of the Lumen Field site? It's opening up tomorrow, how this will impact Seattle-King County Public Health's efforts in getting this area vaccinated. And then also yesterday, the president announced that deadline of vaccines being available to all adults by May 1st. Do you think this is feasible for King County, and will Lumen Field play a role in that?
Well, thank you. Lumen Field is a well-designed, high-throughput vaccination site that's going to serve our community. It's particularly noteworthy in that it does have the ability to scale up very dramatically when doses are available and demand is available, or corresponding demand is in the community, so that they can serve large numbers of people. It's on good transportation routes, and it's a very accessible site. So I think it will be another asset to our community, along with our other high throughput sites and our other modalities of delivering vaccine. The high throughput sites are very important because lots of people can access them, but not everyone can access them. And so, it can't be our only strategy for vaccinating here in the county. And that's why we're investing lots of time and energy, and our community partners are also investing time and energy in the other vaccine delivery mechanisms that are so incredibly important. For example, through the healthcare system, through hospitals, through our community health centers, through our pharmacies, and some of the mobile and community-based sites for those who have trouble accessing some of these large-scale, high-throughput sites, or for whatever reason don't find them to be good options for them or their community members. So Lumen will, I think, undoubtedly be an asset to our community, and we look forward to having as much vaccine as possible to meet the demand that they can help us serve. With respect to the president's announcement, by May 1st, he would like to see all adults made eligible for vaccine. I think that's a great goal. But again, eligibility in and of itself doesn't guarantee access to vaccine. So what needs to come with that eligibility is vaccine supply. Right now, we have many more people eligible in the county than we have doses for. And we know that in the 10 days, we're going to have approximately 400,000 newly eligible or total eligible. But our doses aren't going to increase proportionally. So everyone needs to understand that although people are becoming eligible very quickly, the eligibility is outpacing the vaccine status. The vaccine supply. So there will be delays in the time between someone becomes eligible and the time they can access vaccine. But those delays over time will decrease. Vaccine supply will be increasing. And I'm very optimistic that with our disease rates decreasing, people will be able to remain safer if they continue to take precautions. And we'll have fewer people hospitalized and dying because we're vaccinating the highest risk people first. And we're moving in the right direction in many fronts, but patience is still going to be required for the next several months.
Great. Now we have a question from a viewer on Facebook Live. Their question is about the decision-making process for opening up additional tiers to receive the vaccine. And they're wondering if it's true that once 50% of a given tier has received one dose, if that means the next tier is eligible for vaccine.
Thank you for your question. The tier eligibility is decided by Washington State, and they, I believe, take into account a number of factors. But if the 50% coverage rate of a prior tier, I do not believe is a trigger for moving forward.
Thank you. And one final question from viewers on Facebook. They want to know what you think about President Biden's recent goal of Americans being able to safely gather by July 4th of this year.
I love it. How could you not love it? It will depend on being smart and being lucky. We're going to need a few things working in our favor. If we do not do things that accelerate the pace of the epidemic, if we continue to be smart about COVID-19 prevention and suppress transmission, and we don't let the new variants gain a foothold, and at the same time we continue to vaccinate as many people as possible, I believe that by July 4th, it is quite possible that we will have reached that equilibrium where we have large numbers of vaccinated Americans, and we have low numbers of COVID-19, and hopefully low numbers of variant strains, that our vaccines remain effective against the new viruses that emerge over time, and that we can have some really nice barbecues again.
Excellent. And with that, that completes our questions. Any concluding remarks, Dr. Duchin?
Well, as always, thank you for joining today. Thank you to everyone in the community for all you've done to get us to this relatively good point. To those of you who are still being impacted by this disease, who've lost someone that they love, a friend, family, community member, or who has been sick themselves, we send out our deep condolences, and we have you in our thoughts, and we are looking forward to the day when this disease is no longer our sole preoccupation, and we can turn our attention towards so many other things that we need to do in our community to heal from this outbreak. But in the meantime, we need to hang in there for a couple of more months. Give it our same effort, that level of effort that we've shown to date, and with good luck and good effort and continued vaccine supply, I'm very optimistic that we'll have a very nice summertime.
Great. Thank you so much, and thank you to everyone who joined us. As a reminder, you can follow updates from Public Health on social media at KCPubHealth, and follow our blog, publichealthinsider.com. Thank you.